Hello, this is a series of exercises for lower back pain. It's appropriate if you have acute low back pain, so it's just started, it hasn't been there for a long time, and of course I can't assess you here on YouTube, so I'd like you just to have a look through my description box to see how appropriate these exercises are going to be for you and how much they're going to help. So they're very simple exercises to start off with, not with any equipment, just with a towel, which hopefully that you have at home. Okay, so we're going to start off with some mobility exercises, so hopefully you can get down onto your back. That's the first test. So if you are struggling, then coming down onto the elbow here, lowering yourself down and then rolling over onto your back is probably the best option. Feet are going to be hip width apart, and we're just going to be doing some shoulder bridges. So we're going to tuck the bottom under, flatten through the lower back, peeling up all the way up to this ski slope position here, and then tuck back under and curl back down. We're going to be working on the pelvic tilt here, so if you arch the lower back a little bit there and then tuck under, flatten, curling up, peeling up one vertebra at a time till you get to the top, and then curl and peel back down again. On the way up, you want to think about pulling the ribs down, tucking under, curling up one vertebra at a time, not going up too high, keeping the bottom engaged, and then on the way down, thinking about placing one vertebra down at a time. Think about some wet sand that you're trying to imprint one vertebra at a time. Something else I want you to think about is keeping the weight through the heels. So tuck under, curl up, keeping that weight down through the heels. Good, and tuck under again and curl back down again. And then the next thing to think about is pushing the knees away from you. So tuck under, curl up and push the knees out away. Good, don't go up too high. Tuck under and curl back down. Now if these are feeling quite nice to do, then continue. Do a few more of them. But the next mobility exercise that I'm going to do is with a rolled up towel. So you're going to hopefully have this prepared already. You're going to fold it in half long ways and then roll it up, and we're going to place it just along your thoracic spine. So the thoracic spine is from here up to the neck, and it tends to get extremely tight when you have low back pain, and it's one of the causes as well. You want to have a little pillow for your head here as well, so your head isn't off the end. We're going to roll down onto it, head is on the pillow, and we're just going to be opening out through this thoracic spine. So you just need to lie here for about 5 minutes. Now it's a wonderful thing to do at night when you're feeling quite stiff at the end of a working day or a day looking after children, bending over, tightening up through the thoracic spine. It's going to open out through the front of the chest, stretching out the pecs a little bit here. You want to have the pillow probably a little bit higher than mine is here. So I fold this in half, it'll probably work much better, it's much more comfortable. Keeping the shoulders down away from the ears, and then just lying there and letting it do its trick. It doesn't feel too much at the beginning, but once you've lay here for between 5 and 10 minutes, you're going to start to feel everything really opening out, and it does depend on how stiff you are around here. So you can also bring it crossways, which is a really good way, a bit more aggressive of loosening off. So again, have the pillow there. So if you don't feel too much on that first exercise, you can bring it lengthways or across your back, and that should mobilize and release through different parts of the spine here. You can bring it a little bit higher, and one way of mobilizing a little bit more is to bring the knees into the chest, and you can just pulse them in towards your chest here. That will mobilize even more. Now this is one that might feel a little bit uncomfortable, so I don't want you to push through any real discomfort on this one here. It's another one, if you bring your legs down one at a time, arms out to the side, you can actually roll your legs over from one side to the other. And this can really rotate and mobilize again through that thoracic spine. It's one of the areas that gets extremely stiff with lower back pain, and it's one of the biggest causes as well. So if you get stiff through your upper back, the lower back has to move more. It becomes unstable and then spasmy. So one of the biggest reasons So loosening off through this thoracic spine is one of the most important things. Now you'll notice that I'm picking one foot up. As I take the legs over, my knees and toes are pinned together. And I want you to think about lifting up through this hip, taking the legs over, and then pulling the hip back down. Good, it's the Pilates Hip Twist, if anyone was wondering. Just think about engaging through your tummy a little bit on this one as well. You can do it, of course, without the rolled up towel here too. That's a little bit more useful. Good, let's do one more each side. Brilliant. All right, we're going to move that towel out of the way now. Take your time with all of this. Obviously, you're suffering with some kind of low back pain to be doing these exercises, so take your time. Like I say, you can come down onto your side and then roll over onto your back here. Move this equipment out of the way a little bit. We're just going to move on to some stretches. So from here, we want to do a hamstring stretch. Now, I want to combine a hamstring stretch with a nerve stretch as well. Whether you've got pain going down into the back of the leg or into the bum at all, lower back pain can always benefit from a nerve stretch. So if you pull the toes up just gently, hold on behind the knee there, and we're just straightening and then bending down again. Straighten. You'll feel something going on in this quad, so it can't be too bad to strengthen a little bit through there as well, but it will tire slightly as you're pushing against those tight hamstrings. Good. 3 more. Last one, good. Bring that foot down, bring the other leg up, toes up a little bit, and up and down. We want these nice big movements. We call it neural flossing. So the nerve runs down through a pathway down the back of the leg, the sciatic nerve in this situation, and it does get tethered down through its pathway, and we want to free it up to glide and slide through that pathway. Nerves are not like muscles. They don't get tight. They just get stuck down through their root. Can cause all sorts of problems when they then start to tug and pull on the lower back. Good. 3 more. Now try just one set of these to start with, but you can always pause the video, do another couple of sets if you find they're pretty useful. So coming on to our fronts here, we're just going to do some little back extensions. Now these are not appropriate for everybody, so just be careful if it feels like it's irritating. We're just on the elbows here, and we're not pausing necessarily up the top or down at the bottom. It's a movement up through. So this is the simplest version here. Good. Keep everything relaxed. We're trying to mobilise through the lower back here. Good, and you can just put the hands underneath the elbow, underneath the shoulders to do a little bit more. Bring them a little bit wider if you want. Bring them a little bit forward. So fiddle around with these positions to what feels best. Feel free to keep your lower abdominals engaged just a little bit on these ones. So scooping in those lower abdominals. Good. Stay on the elbows if you're struggling with this one. I don't want you to push through any pain, but just up to it. So hopefully it's going to mobilise through the lower back. If there's any disc issues going on, these will help to relocate the disc a little, in theory. Good. And then while we're here on our fronts, we're going to stretch through the quads. Now if you can't get hold of the foot, we can use this towel again here to wrap around the foot here, and you can pull in. But ideally, if you've got enough range, you'd be holding onto it. Tuck the bottom under, keep everything straight, don't twist too much on the back with this arm. Good, and then we're going to do the other side. Good, so you can hook that around. If that's a little bit awkward, you can use a stretchy rubber band or something, if you happen to have one of those at home. Tuck the bottom under, keep the knees together a little bit, pulling the heel towards the bottom. I'm going to hold these stretches for 30 seconds, And then again, try for the first time just once on each side, and then after that, if everything's fine, try it twice on each side and pause the video. Okay, so another big muscle that's very much involved with lower back pain is your lats. So they come and they attach from the front of the shoulders, and they attach down into the lower back here. They can really tug on things. So this is a really lovely position to stretch in anyway, is the child pose. You can widen the knees a little bit so that you can sink down a little bit more. That should be, in some of you, stretching your lats already. But if you just walk your hands to one side and then get hold, then you can stretch this side a little bit more. So if you breathe into it, you'll find you get a little bit more of a stretch there. It's also mobilising a little bit through the lower back here in this position. Good, and then you can walk to the other side and get hold there and stretch. You can even sort of stretch your bottom over towards the opposite side, just to get that little bit of a stronger stretch there. Good, excellent. So a muscle that's going to be involved with a lot of you is your piriformis, which is a deep muscle. The sciatic nerve either runs through it or very close to it. So we're just going to bring this leg up, cross it over the other one at the ankle, put one hand through the gap here, and then hold on with both. That should be enough to give you quite a strong stretch deep inside that hip. Now, some of you might feel it in the front of the hip, therefore it might not be completely appropriate to you. You might find you've got to do some different stretches to get yourself able to do this one. If that's too much, you can keep that leg down and just push down on that knee, trying to keep the hips level. Again, another way you can do it is just pulling in here. All right, other side, bring that leg down, cross the other one over, open out through the knee, reach through the gap, clasp your hands together and then pull this one in. Good. Like I say, you can drop that leg down and just push the knee away with that hand. It's nice to do these little variations anyway, just to see which one you feel it more and you can grasp hold of that foot. Push away with this one, pulling in with this one. Good. Always keeping this leg bent. And then you're just taking the pressure off your back just a little bit. Good stuff. All right, we need to do just a couple of strengthening exercises. So, onto your side here. A physio's favourite, the clam. So make a pillow for your head with this one. Tuck the bottom hip back, tuck the ribs back, bottom under, tummy scooped in, and then we're just lifting this knee. So stretch the knee out away from you. You'll notice that that knee looks a little bit further away. It's just stretching that knee away. So we want to aim for being able to do about 40 here. So if you're struggling already, then you know you've got a bit of work to do. Good. It's a little bit of a boring one, so it might be a matter of pausing the video again, doing a few more yourself. Good, I'm just going to demonstrate on the other side, so just coming up and over onto your side. Good. Tuck that bottom hip backwards, bottom under, ribs under, pillow for the head, lifting up. You should be feeling it in here, not down into the leg, definitely not on the inside, not on the outside, and not in here. So if you're feeling it in any of those places, then you're not in the right position. You should be tucking that hip underneath you, bottom under, ribs under, scoop the tummy in, and then lifting this knee. Or it might just be that this exercise isn't for you, so it's not one to push through if you can't get the right position and you can't get it just working in here. It's okay to be working on the leg underneath. Okay, last and possibly most importantly, with any low back pain, then the deep core muscles switch off. We know that, we don't know why, but when those deep core muscles switch off, the spasm then tends to take over to stabilise through the back. Now sometimes the only way of getting rid of the spasm is to switch on the deep core muscles again. They don't tend to switch on their own, they usually need a little bit of prompting. So coming down onto your back again, and feet are hip width apart, long through the back of the neck, wide through the chest, melt those ribs down, rock backwards and forwards a couple of times through the pelvis. Try and find that central position where there's a tiny gap underneath. We know that the deep abdominals, the transversus abdominis, your corset muscle switches on much better when you've got a neutral pelvis, and that's somewhere in between here and here. Now settle somewhere in between, and then I just want you to use your pelvic floor as the cue. So if you scoop, lift up through the pelvic floor, do it slowly, not one grab. So count to 5 on the way up, squeezing. If you just go in an inch and down an inch from your, we call them the ASIS, but the hip bones at the front there on the pelvis, poking in. If you tighten through your pelvic floor, you should feel a tightening under your fingertips. So once you've got that, so if you tighten and hold for 10, it's quite nice to do 10 breaths. Just trying to hold that contraction, breathing into your lower outer lungs whilst you're holding that contraction. That should help to stabilize through the lower back. So 10 times, 10 breaths on that one. You may then feel like you need to do just a couple of these shoulder bridges again to release things off. Excellent. So I hope you found that informative. For acute low back pain, just remember to check through the description box to make sure that everything's appropriate for you, and make sure that if you have any pain doing any of the exercises, then to stop them straight away. Go and see your GP, go and see your local physiotherapist, or me if you're local to me. Make sure if you like the video, click like, give me a comment in the comment box, ask me about yourself, give me a comment on the video, and remember to subscribe for more useful tips.